The Vantage Surgery Center is a joint venture between Virtual Hospital and Reconstructive Orthopedics, so that we can deliver the same excellent orthopedic care we delivered at the joint center in the hospital at an ambulatory surgery center.
Patients are welcomed in the entry to the Vantage Surgery Center and then brought back into the preoperative area. They're greeted, everyone knows their name in advance, knows exactly what's happening, and their family is with them through this period.
We get them all checked in with the nurse, and the surgeon would usually come into the room and have a brief discussion with them, talk to them about the surgery, sign the leg that we're going to be operating on, and then the patient would go to the operating room.
The patient's outcome does not just depend on the surgeon. It's not just me and a good operation. It's having good assistants, nurses, anesthesia, and even people at the front desk and even at discharge that are friendly, efficient, and proficient in everything that we do.
The idea is that the operation happens without the patient's knowledge, and they're continuing the conversation they began as they wheeled into the room on their way to the recovery area.
In the recovery room, we have a staff of nurses trained in taking care of patients who've just had surgeries, be it smaller ones or larger ones like joint replacements. They make sure that they wake up from the anesthetic agents properly and feel comfortable as anesthesia wears off. They're monitored closely over the next few hours, and as soon as they are able to, we have them visit with their family, have a snack, because most of them have not eaten since the night before in preparation for surgery, as is typically done, and then get them up.
It's the most important phase for the patient because they overcome their apprehension about leaving. And the goal is not ever to send a patient home who still has that fear. The recovery area with the family present is designed to reestablish their confidence that they're on their way to a successful recovery.
Patients consistently tell us how they felt everything was run very efficiently and smoothly, and they're often really surprised at how good they feel, not just physically from the surgery they had, but also mentally because they knew that they were well prepared before surgery, but also to go home from the surgical center. Overall, the satisfaction rates are as high or higher than they are at any setting, which makes us happy because at the end of the day, the goal is to get a good operation done for the patient, make sure they get a good outcome, and that they're happy with what they did.